Raised on Midwestern values, Dr. Herman Pang strives to touch as many lives as possible. As a cardiothoracic and vascular surgeon, Dr. Pang focuses on the treatment of varicose veins, a potentially serious medical condition affecting millions of Americans. Here's more.
I'm Dr. Herman Pang, and I'm a cardiothoracic and vascular surgeon. I was born in Lincoln, Nebraska, but I basically grew up in Denver, Colorado. One of the reasons why I wanted to get into medicine was to try and effect a change in as many people for the positive as I could.
Dr. Pang is a specialist in the treatment of varicose veins, which, left untreated, could lead to serious medical conditions.
Varicose veins represent a spectrum, but basically they're superficial veins in the legs, and because of genetics and because of our upright lifestyle and because of gravity and everything else, the veins in the legs tend to not function appropriately. Therefore, blood goes backwards, which impedes your circulation. When I was in my training, many years, unfortunately, ago, the conception, which actually was a misconception, was that varicose veins and vein problems were really more cosmetic than medical. And we've made a lot of advances and a lot of strides through the years. And we now realize that vein problems, vein disease, vein reflux, it becomes very much a medical and not a cosmetic issue.
Although a lot of people think varicose veins are just cosmetic, in my situation, they were extremely painful. I was in so much pain that a lot of times, if I didn't have my stockings on, I kept my phone right beside me because the pain was so bad that I was afraid I was going to have to call for help. Dr. Pang, when he saw my legs and the varicose veins, he took it seriously. He knew how much pain I was in.
Varicose veins are most commonly found in the legs and occur when blood that normally flows upward towards the heart instead flows backwards. The blood then pools, causing veins to become damaged, enlarged, and oftentimes extremely painful. In the past, the treatment for bad varicose veins was a fairly barbaric treatment, which was vein stripping. That was very painful. Take a couple of days of being in the hospital, takes about a month to recover.
I had heard of more invasive, older vein stripping procedures to take care of varicose veins, but with my lifestyle that just wasn't going to work for me. I'm a mother of 4. I have a busy day. It starts at 6 o'clock in the morning and doesn't end until late at night. I couldn't be off my feet for days in recovery.
Vein stripping, in my opinion, should probably be of historical interest only, and because of that, patients who would have been frightened from surgery, from the risk of general anesthesia and from this somewhat barbaric treatment, they can now be offered this much more elegant, minimally invasive office procedure that has basically minimal risk and tremendous success.
The procedure was really nothing at all. It was simple in-out procedure, no real downtime. I can't even imagine living in the pain that I was in.
Coming up next.
Radiofrequency works by delivering a pulse of energy directly to the vein and successfully closing it off permanently. It's like using an eraser to get rid of veins.
Welcome back. A new procedure called Veingogh now offers patients more options for total vein care. Here's more.
Veingogh closes off the small spider veins that you see in this patient's ankle. She's had one treatment in the past as well as other vein intervention, and we're just working in this area here today to clean up the rest of the veins. So we'll start down here at the ankle. It's a little tiny fine needle tip, and you just apply it to the skin and you deliver energy with a foot pedal and go along the length of the vein to close it off permanently. Most people feel some mild discomfort with this treatment. It's not extreme by any means, and the discomfort does not last beyond the treatment. Notice as we apply the energy to the specific vein we're treating, you see it instantly disappear. It's like using an eraser to get rid of these veins. Radiofrequency works by delivering a pulse of energy directly to the vein and successfully closing it off permanently.
To be a part of this technological revolution, as it were, is extremely gratifying. By working on vein issues, vein problems, circulation problems, you can see fairly dramatic improvement in the quality of life, and certainly I can touch and I can affect a larger number of people in this environment than in any other environment. When you have a patient who basically has given up, who's got an ulcer by their ankle that won't heal, that's in agony, and when we do one treatment and then within a matter of days that wound heals and the pain goes away, the patients are very grateful, and that to me has got to be the most rewarding part of this practice.